No description of the coronavirus is more misleading than calling it the great equalizer. The horrific truth is that Native Americans, Latinos, and African Americans are dying at much higher rates than white people. And we don't know the half of it because the CDC hasn't released any racial data about the virus. We don't know if they're even collecting it. But the picture that is emerging across the nation from cities, states, and reservations is that of an atrocity. In Milwaukee County, for example, black people make up just 26% of the county's population, but account for almost half the county's cases and a staggering 81% of its deaths. Louisiana, Illinois, and Michigan are no different. Black people make up less of the overall population, but account for vastly more of both cases and deaths. In San Francisco, Latinos account for just 15% of the population, but make up 31% of the city's confirmed cases and account for over 80% of the city's hospitalized coronavirus patients. And in the country's epicenter of New York City, the virus is twice as deadly for Latinos than for white people. The Navajo Nation, with about 175,000 residents, has more cases of COVID-19 than 9 entire states and more deaths than 13 states. Native Americans are dying in wildly disproportionate numbers. You've heard how governors are fighting over aid, while tribal leaders are getting even less. So why are these communities suffering the worst of this pandemic? For one, Black people and Latinos are more likely to work in essential positions that require them to put their health at risk. A study by the New York City Comptroller found that 75% of the city's frontline workers are minorities. On top of that, Black people and Native Americans experience higher levels of pre-existing conditions like asthma and diabetes that make contracting the virus more deadly. Of course, they don't just happen to have these illnesses. This is the system. It's decades of segregated housing, pollution, lack of medical access, and poverty in action. But the virus isn't just discriminating by race. It's also disproportionately affecting the working class and poor of every kind. In New York City, the 5 zip codes with the highest rates of positive tests for the coronavirus have an average per capita income of under $30,000, while the residents in the 5 zip codes with the lowest rates have an average income of over $100,000. And that's just where there's testing. Remember how early on we heard about celebrities testing positive? If not happiness, at least money can buy you a diagnosis. New York just rounded its death toll up by a few thousand people who were never even tested. Studies show that lower income people are more likely to have chronic health conditions that make the virus more deadly. They're less likely to receive sufficient medical care or might lack access altogether, and they're more likely to work in frontline essential jobs that put their health at risk. A study found that only 3% of lower-income workers are working from home during the pandemic, compared to almost half of upper-middle-income workers. Any rush to reopen the economy is really about forcing working-class and poor people back into harm's way, while the rich and affluent can safely work from home. For as many workers risking their lives for meager paychecks, still more are now unemployed and on the brink of financial obliteration. Less than half of Americans can afford a $1,000 emergency, and nearly 75% live paycheck to paycheck. Piecemeal unemployment benefits and one-time payments are not going to buoy Americans through the next Great Depression, which is what we are in. We are all weathering the same storm, but we are not all in the same boat. Systemic inequality in America has produced 2 very different pandemics. In one, billionaires are sheltering in place on their yachts in the Caribbean, and wealthy families are safely quarantining in multi-million-dollar mansions. In the other boats sit people risking their lives for their jobs, and people without incomes going hungry, a disproportionate number of whom are people of color, and all of whom deserve better. This is a tale of 2 pandemics. There is nothing equal about it.